Hello, my name is James Archer and I'm the Parliamentary Candidate for Erewash. In this video I want to talk to you about the Liberal Democrats' commitment to support the NHS. The NHS was one of Britain's great achievements of the last century, providing care free at the point of need to all who needed it. The NHS has for its entire history been provided by both public and private organisations. For example, the Derby Urgent Care Facility is run by the One Medical Group, a private company, and the Nottingham Walk-in Centre is part of the NEMS Group, a not-for-profit company, and they're not alone. Most GP surgeries are private partnerships. Liberal Democrats have no plans to change this because it's not the cause of any problem in the NHS. And I say that working in a large company has taught me that outsourcing can be cost effective and should not be dismissed without consideration. It does sometimes lead to frustrations about the level of service being provided. Having said that, the NHS should always remain free at the point of need. It is undeniable that there is a crisis in our NHS, and it is one that fully nationalising it will not solve. The King's Fund reports that the crisis is one of a severe shortage of staff, with over 100,000 vacancies in NHS trusts and a further 100,000 vacancies in social care. This represents a massive gap in our ability to treat people and care for people. The House of Lords says that a lack of credible workforce strategy represents the biggest internal threat to the sustainability of the NHS. The Liberal Democrats will produce a national workforce strategy, ensuring that we never again experience a shortage in the number of GPs, hospital doctors, nurses, midwives and other professionals that the NHS needs. The Liberal Democrats believe in the NHS and its core values. Furthermore, the Liberal Democrats are not a centralising party. We believe in care local to where it is needed, insofar as reasonably practicable, because it can make illnesses that much harder if you have to travel large distances to a hospital, particularly for treatment for chronic conditions. A friend of mine's father died recently after a long illness, an illness where he had to receive dialysis on a weekly basis. He was able to receive his dialysis treatment at Ilkeston Community Hospital rather than facing a weekly trip into Nottingham City Hospital, and this eased his care and helped his family cope. We will invest in our frontline GP services as well. They're often the first port of call for patients accessing the NHS, but we will also look to leverage mobile technology to deliver access to the NHS. At the moment, 30% of people access the wrong service. I know I've been told if it is an emergency, don't go to A&E. However, after I've suffered a few finger injuries through playing in goal that were possible fractures, I eventually had to go to A&E despite trying to present to an urgent care centre first. But physical health is only half the picture. Unfortunately, I also have friends who are struggling with anxiety and mental health issues at the moment, and I'm immensely proud of the strength they've shown in sharing their problems with me and seeking out help. The numbers are shocking. 1 in 4 of us will experience mental health problems each year, and 15.5 million working days were lost in the UK last year due to work-related stress, depression and anxiety, at a cost to the economy of £35 billion. I was also talking to a voter whose friends had a complex mental health case, and because of this it took him a year to get seen. We will never achieve equality for mental health with an underfunded NHS, which is why we're committing the extra money. We will make waiting times for mental health care match those for physical health care. And our social care services' greatest resource is their staff, working tirelessly under immense pressure, many of them from other EU countries. This government has left them feeling embattled and undervalued. We will end the pay freeze in the NHS and social care, and we will support innovation on how organisations can empower staff and patients, including learning from innovative social enterprises delivering community and mental health services. The Liberal Democrats will also limit the amount elderly people have to pay for social care so that they can avoid having to sell their homes to pay for their care. This is going to become even more important if we don't fix the housing crisis and an increasing number of people reach old age never having been able to afford their own house. And if we stop Brexit, then we protect our NHS from being the subject of a trade deal with Donald Trump. The Liberal Democrats are the only party with a clear plan for the NHS and social care that concentrates on the problems we have now. Under our plan, the health and care services will be there for you and your loved ones when they need them. We will build a better health and care system that is prepared for the future, provides quality care for patients, and respects our health workforce.